keep it all. Okay. I'll just check it.
The Delaware Division of Public Health says they expect to receive 16,700 doses of the Moderna COVID-19 vaccine this week, along with nearly 3,000 additional doses of the Pfizer vaccine. This news comes after over 2,000 doses of the vaccine was administered at 6 healthcare systems statewide last week, as Delaware kicked off Phase 1A of distribution to high-risk healthcare, long-term care, EMS, and other healthcare personnel.
My job is to get our healthcare providers comfortable with the vaccine, getting them vaccinated, helping us lead by example, and that will help them to then recommend it to all their patients and hopefully get them feeling comfortable to accept the vaccine as well.
Dr. Marcy Dries is the Chief Infection Prevention and Hospital Epidemiologist for ChristianaCare. A liaison to the CDC's Advisory Committee on Immunization Practice, she says it is estimated that at least 70% of the population needs to be vaccinated in order to achieve herd immunity from COVID-19.
I think it's important for people to realize that these vaccines are based on 17 years of research on mRNA vaccines, on coronaviruses. They studied SARS-CoV-1 back in 2002. We're developing vaccines for that virus. But then, obviously that did not turn into a pandemic, so the vaccine was no longer needed. So it feels like it's been less than a year, but it's actually built on this whole body of science.
So much went into this, and although the process was accelerated due to the magnitude of the pandemic, the safety protocols were not rushed. And that's why I'm here today and got vaccinated, and I hope everybody listening does as well.
Dr. Rose Kokoza was one of ChristianaCare's first wave of frontline healthcare workers to receive the COVID vaccine on Friday. Since the pandemic began, she says Wilmington Hospital has seen a distinct disparity in the patients they have cared for battling COVID-19.
The COVID-19 pandemic has disproportionately impacted Black and Brown communities, and this vaccine is the beginning of us trying to get ahead of that. What we're doing at ChristianaCare is making sure that we're getting the message out to our community to get the vaccine, that it's safe, that it's effective, and that it can help to prevent the spread of what we're seeing right now.
Thank you, Kristen.
I tried my best.
Didn't hurt a bit.
As the state continues to distribute the vaccine in coming weeks, Dr. Dries says it is extremely important for everyone to continue wearing masks and social distancing.
The studies really looked at prevention of symptomatic COVID. The primary endpoint was not your ability to transmit to others. Right now, we don't know for sure that if you're vaccinated, you could still get infected, never know it because you're not developing symptoms, whereas you might have gotten sick had you not been vaccinated. So we still need to protect, ourselves and others even after we're vaccinated.
Reporting from Wilmington, I'm Mikaelyn Austin, 22 News.